Good day everyone. In this video, I'm going to briefly talk about our work entitled pH-weighted amide proton transfer magnetic resonance imaging, or APT MRI, better delineates the acidotic ischemic penumbra. So for acute ischemic stroke, one of the main treatment options is recanalization therapy. And basically the main aim of this treatment is to salvage the penumbra tissue. And currently, the only FDA-approved drug for this purpose is the recombinant tissue plasminogen activator, or RTPA. And while RTPA has been shown to be largely beneficial, this drug does come with two major limitations. Firstly, that it has to be administered within 4.5 hours from symptom onset. And secondly, there is a risk of hemorrhage when administered. And because of these limitations, only around 5% of patients receive this treatment, although it could potentially benefit more. And because of this, there is a need for an imaging technique that can accurately identify the penumbra area in order to better stratify patients to receive this treatment. So the current conventional method of estimating the penumbra area is through the spatial mismatch between diffusion and perfusion weighted imaging. However, these MRI techniques actually inaccurately estimates the extent of the penumbra, where we can see from this example, although this method estimated the penumbra area to be quite large, we can see from the follow-up scan here, the true final infarct turned out to be much smaller than what was estimated. So this method of estimating the penumbra actually falsely includes the benign oligemia regions. And because of this, there is a need for an imaging technique that can better estimate the penumbra area. So in our study, we investigated the use of amide proton transfer MRI for estimating the ischemic penumbra. And basically, amide proton transfer is a variant of chemical exchange saturation transfer, or CEST, which is an MRI technique that is pH weighted. So the way that CEST works is that in our bodies, we have an abundance of water represented by the water pool here, and we also have labile pools, which are basically any functional group such as amide, amine, or hydroxyl that undergoes chemical exchange with water. So basically, inside the MRI scanner, we apply a radio frequency pulse at the resonance frequency of the labile pool, and this causes the protons of the labile pool to become saturated. And then through a chemical exchange saturation transfer phenomenon happening between labile and water pool, this saturation is then transferred over to water, such that when we measure the signal coming from the water pool here, we observe this dip in the spectrum here that is due to this CEST effect. And CEST is actually pH sensitive because the exchange rate of the chemical exchange process happening here is base catalyzed. And this means that when pH drops, the exchange rate decreases. So we observe a smaller CEST effect in the spectrum. And conversely, when pH increases, the exchange rate increases as well. So we observe a larger CEST effect in the spectrum. And that's basically how CEST is sensitive to the intracellular pH changes in the brain. So basically, amide proton transfer, APT, is a variant of CEST that is related to the amide protons in the backbone of endogenous proteins and peptides. So during ischemic stroke, when cerebral blood flow levels drop significantly, the tissue undergoes anaerobic glycolysis, which then causes the tissue pH to drop due to lactic acidosis. So essentially, tissue acidosis is one of the signs that happen before infarction. And because CEST and therefore APT is pH weighted, it's hypothesized that APT MRI may be able to better identify the acidotic penumbra compared to conventional MRI. So through our experiment using animal stroke models, this was what we observed, where when looking at the conventional MRI, the diffusion deficit areas were smaller than the perfusion deficit areas, but when looking at APT, the APT deficit areas were larger than the diffusion deficit areas, but smaller than the perfusion deficit areas, where we can see that the blue region coming from APT is between the white and the green areas coming from the conventional MRI. So basically, this means that APT was able to further separate the diffusion and perfusion mismatches into zones of acidotic penumbra and benign oligemia. And essentially, APT was able to better delineate the penumbra area compared to the conventional MRI. So in conclusion, APT MRI is a non-invasive imaging technique that shows promise in complementing conventional MRI techniques to better delineate the acidotic ischemic penumbra and improve acute stroke diagnosis. And with that, I would like to end this presentation here. Thank you for listening.